Hi everyone, I'm Dr. David Bernstein. Welcome back to our series, 25 Tips for Working with Modes. Now, last time we talked about the importance of genuineness, of being ourselves in our relationships with patients, whether those are relationships, in a therapy session or on a ward. And that also raises a lot of questions about, to what degree can we share things about ourselves with patients? To what degree can we share our emotional reactions with patients? Or share even personal things about ourselves. And that brings us to our topic for today, share it. Now, self-disclosure can be an incredibly powerful technique if handled properly. It can deepen our sense of closeness to patients, their sense of their bond with us. Self-disclosure can give them important corrective information about people's reactions to them when they're in certain kinds of modes. We can choose to self-disclose, for example, for a variety of purposes, to create a sense of playfulness in patients who may have missed out on that growing up, sharing interests, what kinds of books we like, what kind of books they like, or films or sports and so forth. So there are a whole variety of reasons that we may choose to self-disclose. But when we self-disclose, we always do it for a specific purpose. We don't just self-disclose because it feels good to us or because it feels good to the patient. We always have something specific in mind. And so here are a couple simple guidelines that you can use in trying to figure out when and how to self-disclose. The first crucial point is when we self-disclose, we always need to keep in mind which mode is present in the session at this very moment, which mode is active right now. We've emphasized in the series up until now, how important it is. That's always the starting point in our interventions, right? So we observe the mode that's present, and then we may adjust our interventions according to it. And as you're going to see in a couple of examples, how we self-disclose and whether we self-disclose, is crucially dependent on which mode it is. And then the other thing is when we self-disclose, we always do it in order to meet patients' emotional needs. We're always focusing on, what are the unmet emotional needs of patients and how might self-disclosure, benefit them in terms of, starting to get those needs met, in their lives more adequately. So let's take a couple of examples. Let's say you have this mode in the room with you, the self-aggrandizer mode. Let's say you have a patient who's, let's say putting you down, a patient who is telling you that, you're not as good as his last therapist, she was much better than you, or maybe he's telling you that, or asking questions about your professional credentials, where'd you get your degree from? And let's say, you recognize this mode in the patient, and maybe there's a side that he's developed, to protect himself, right? This is an overcompensatory mode, maybe underneath this is a patient who was neglected or, felt inferior, and he's developed this side of himself, that takes the one-up position in order to protect himself. Now here it could be beneficial to use some self-disclosure. Maybe, for example, in the case of this patient, maybe he's somebody who really doesn't, have sufficient empathy. And, he doesn't really quite realize, how these kinds of statements, might affect other people, when he puts them down. So you can imagine that even in the rest of his life, that, getting some corrective feedback could be very helpful. So again, here we're focusing on the emotional need of empathy. And so, but how do you do that? Well, let's say that you're somebody for whom, being put down is a real wound. Let's say that's something that you've experienced in your life growing up. Let's say, you have a feeling of defectiveness or inferiority, and that's something from your past. And maybe when the patient's putting you down, that side of you gets triggered. Well, the question is, should you then self-disclose that, or how do you self-disclose that? Well, as we've emphasized in this course, it's really important to embrace your own reactions and accept them. They're a side of you too, and they come from somewhere. And then to take a moment to recruit your healthy adult so that you can go further and then redirect your attention to the patient's mode and decide how to intervene. So it could be that you use the information about your own emotional reaction to give the patient some feedback, but how do you do that? Let's say that you were to say to the patient something to the effect of, hey, I see this side of you, and when you put me down, then I end up feeling wounded or hurt, or I feel inferior. Well, when I say this, it's very obvious that that's not the right thing to do. And why is that? Because in effect, the patient's taking the one-up position, and by saying something like that, you would be taking the one-down position. He says, I'm superior, and you would be in effect saying, I feel inferior. And that would take you out of your professional role. Because our role as therapists and as mental health professionals is an expert and authoritative one, right? The patient needs that. He needs to know that you can handle what he throws at you. And if you take the one down position, even unconsciously, you step out of that role, and that's not to anybody's benefit. So how could you self-disclose here in a way that would be beneficial and keep you within your expert and authoritative role? Well, again, you could use a version of I see a side of you that, I see this side of you right now that's telling me that, hey, your other therapist was better, and, kind of wondering where I got my degree. And, I've seen this side before, and we've talked about it a little bit before. There's a side of you that can be very easily disappointed in people. And, I get it. I understand where that comes from. And, look, you have the right to have that side. But I think one thing that's important for you to recognize is that, I'm a professional, and I realize that, when you talk to me that way, I understand there's a reason for it, that your, feeling of other people not being there for you is very, very strong. It's a, very strong feeling from your past. And yet at the same time, the way you say these things, when you're in this mode, I don't think you realize how they come across. Because, look, I'm a human being, and, questioning my credentials and so forth, there's a side of me that's, hey, who's this guy? Now, at the same time, from my training and experience, I know that this is just a side that's protecting you. But I suspect that when you do this, outside of here, in your relationships with other people, that other people probably don't get where you're coming from. And I wonder what kind of reactions they might have, to this side of you. Okay, so here's a way in which you're self-disclosing, not so much going into depth about what your own emotional reactions are, but just essentially emphasizing the fact that you are a human too. But at the same time, you're a professional and you have the ability to understand and rise above your own reactions and be there for him. So this might be a way that you could give him some corrective feedback using self-disclosure that could be helpful to him. Okay, let's take one other example. Let's say you're going on holiday, going on vacation, and you have a patient who has a strong reaction to it. You might choose to self-disclose some information about where you're going on holiday. Now, if the patient doesn't ask about it, there's a question about, whether that might be helpful or unhelpful. So you may want to follow the patient's lead, or you could even ask the patient about it. Is that something that she's has crossed your mind to wonder where you're going? Or, maybe this is a patient, let's say it's a borderline patient, and the way she copes with, having strong abandonment feelings, coming from an abandoned child mode, is just to detach. So maybe she's really trying not to think about it. And in that case, if you were to tell her at this point where you're going on holiday, it might actually overwhelm her because, she needs her coping. That's the way she's coping right now. So, self-disclosing in that moment might not be helpful. It could, in fact, be counterproductive. But let's say the patient asks you about it or indicates some openness or, some interest in knowing. Well, if a patient has an abandoned child mode, it usually comes from repeated early experiences of having been abandoned or experiencing a lot of, unpredictability or instability in their lives. And so, this could be going on holiday, could be a kind of corrective emotional experience for her. Because, you can't always prevent abandonments from happening in life or separations from happening, but you can do it in a way that is sensitive and attuned to the other person and providing her with the experience that, when people leave, they still care about her and keep her in mind, and that they're coming back could be very healing for her. So here you might choose to share a little bit about, where you're going and what you're doing. Again, I would suggest here, don't go too far. You don't need to give her lots of details. But if she can have a little bit of an image of, where you're going on your holiday and, that you care about her and you're going to be thinking about her, that could help her, to hold on to you, as a caring person who's going to come back. Okay. So here again, the takeaway message is, that when we self-disclose, we always do it to meet a particular need. And in this case, the need is to provide a corrective emotional experience, that will help a patient ultimately to feel more of a sense of, predictability and stability and security in their lives. And finally, when it comes to self-disclosure, I would just say in general, know your own boundaries and respect the patient's boundaries. Never share something with a patient that you feel uncomfortable about, okay? So you have the right to your own privacy. So, if a patient's pressing you and you don't want to share it, then you really shouldn't share it. And at the same time, we don't want to share things that cross patients' boundaries, that provide them with information, that leave them feeling uncomfortable and they cannot handle and may be counter-therapeutic. Okay. So, in these first 10 videos in the series, we really talked about working with modes that are active, in the here and now, whether we're in a therapy session or on a ward. Which mode do I have here in front of me and how do I deal with it? And now we're going to turn to the next set of videos that have more to do with building awareness of modes and helping patients to understand the patterns in their lives that are based on modes and how they can overcome them. And that brings us to our next video, Show It. And finally, I wanted to invite you to come to our website, www.imodes.com, and take a look at our image-based therapy tools. Okay, have a great week and see you next time.